Well, California is gearing up to distribute COVID vaccines on a wider scale.
But some people still remain skeptical and say they aren't ready to get a vaccine. In a special report, KCRA3's Brittany Johnson details the concerns and what community members are doing to address them. She joins us live with more. Brittany?
Well, Brian and Lisa, one group hit hard by the COVID-19 pandemic is African Americans. Now, some do remain skeptical and hesitant to get immunized, pointing to a history of mistrust by the healthcare industry. Now, doctors say those concerns are valid, but also add it is time to turn the tide and trust in vaccines.
Infections, hospitalizations, and deaths from COVID-19 continue to rise across the country. The virus having some of the harshest effects on Black communities.
We don't want to have a period of worsening of our disparities and a lost generation of our young children of color.
In California, Blacks make up just 6% of the population, but account for 4% of coronavirus infections and 7% of COVID-related deaths. Health officials pushing for Black communities and other marginalized groups to have access to vaccines, crucial to defeating the pandemic. Barbershops and hair salons, staples within the Black community. Today, we're going to eminent domain to see how people here feel about the vaccine.
Man, to be honest, the community is scared. Especially my generation. You know, I wouldn't really say scared too, but I say like skeptical.
I'm honestly scared to take anything. I'm really scared to put anything in my body. So I think that's my main fear.
The barbers here at Eminent Domain tell us when it comes to the vaccine, they're not interested.
I don't plan on having anything to do with any vaccinations. I don't want to deal with it.
Co-owner Genesis Whitehead says he'd rather wait and see how the first few waves of distribution is handled.
The side effects is really what I'm looking at. Like, I don't want to get sick, or it might make me worse, or it can cause me other health issues.
Also holding them back, distrust in the medical field.
There's been so much misinformation about COVID in itself. So now we're going to trust a vaccine when we don't even really have full details on COVID.
Leah Lawrence says a vaccine is needed, but wants to see more research and testing before she would feel comfortable taking it.
I do have medical people in the family, and they're like, without a doubt, you need to get vaccinated. So very conflicted.
Head of general thoracic surgery at UC Davis Health, Dr. David Tom Cook, says the lack of trust some Black Americans have for the medical system is merited.
There's a profound distrust in many of our communities, especially Black and African American communities, in regards to healthcare. And that distrust is warranted.
Scars of historical traumas that help explain that distrust. There's the notable Tuskegee study, which began in the 1930s and lasted 40 years. Hundreds of Black men already infected with syphilis intentionally left untreated by doctors so they could research the effects of the disease on their bodies. There's also Henrietta Lacks, an African-American woman whose cancer cells were removed and, without her knowledge, used to create one of the most important cell lines of medical research. The cell line became a billion-dollar industry. Lacks passed away in 1951, but her cells continue to impact the world. Up until recently, the Lacks family received no payment. Scars that still resonate today.
COVID-19 started last year, and they already have a vaccine that fast. Did they already know that the COVID-19 existed, or did they just put something together real fast and then making us lab rats?
You're not a guinea pig. Individuals like us who participate in the trial were the guinea pigs. And now we have a defined product that you can benefit from.
For Pfizer, African Americans accounted for 10% of patients in the clinical trial, including Dr. Cook. Feeling it was imperative to change the tide, he signed up in hopes his decision and transparency about the process would help build trust in his community.
I myself had very little symptoms. I did have some muscle ache at the site of injection. And a little bit of fatigue, perhaps. It's hard to say because I'm always tired based on my work. But no real significant symptoms, and I operate for a living. I do surgery for a living, and I did not miss work at all.
Both Pfizer and Moderna received FDA approval, and both companies tout nearly 95% effectiveness. But Dr. Cook says it's more than just stats needed to get the message across.
The onus is on healthcare to understand our communities and reach out and communicate in a language that they understand. And that's not only literally, but figuratively.
Now, the state has a plan in place that calls upon faith leaders and other trusted individuals to get the word out, but not everyone is on board.